Hey, good afternoon, good morning, and good evening, wherever you are, and welcome back to yet another episode of the AIP podcast. I'm your host, Cheng, the CEO of Supercharge Lab, and of course, on behalf of the AI Partnerships Corp. Today, we have a special guest joining us, and it's an absolute pleasure to introduce her. Let's all give a warm welcome to Mahshid Yassaei, who is representing Tali AI. Mahshid is the co-founder and CEO of Tali AI, an AI-powered voice-enabled virtual assistant that streamlines healthcare workflows by cutting down time spent on documentation and administrative tasks throughout the day with the power of AI ambient scribe, medical dictation, and voice virtual assistant. In this episode, we're going to dive deep into the world of Tali AI, exploring its intelligent capabilities and how it empowers healthcare professionals to maximize their time with patients. So, hey, Mahshid, thanks for being on our podcast today. What a thrill to have you.
Hello, thank you so much for having me. It's a pleasure to be here.
Absolutely. To kick us off, maybe we can start with your story. How did you come to, building Tali AI?
Yeah, so I'm a computer scientist by training. I studied at McGill and worked at BlackBerry as my first job. And then started my first company in 2015, which was also a software company in healthcare. As part of that, we worked with a wide range of organizations from government agencies to hospitals to small startups, built over 40 products in this space. And Tali is really a spin-off of Evenset, my previous company, where we in 2020 we identified physician burnout to becoming a more and more important problem for the healthcare and experienced by providers, but also by patients and the healthcare system overall. And that's when we started working on Tali.
So, what are the challenges or problems that Tali is really trying to solve for? Let's name a couple of them.
So physicians are losing 10 to 15 hours of their time per week on documentation and administrative tasks. So after each patient visit, they would have to document the content in the form of a structured and unstructured pieces into their software. And this is very time consuming, but also it's very mundane and repetitive. And sometimes they have to take it back home. They call it pajama time. And it's very frustrating for them. It's also a lot of cognitive load for them to have to remember or take notes during the patient conversations. As patients, we experience this when our doctors are always exhausted and distracted, and they're always facing their screen typing as we're talking to them. And in the healthcare, we are experiencing this as the shortage of doctors and nurses, because a lot of these clinicians are thinking of leaving their jobs because of this physician burnout. So it is a major problem, and it has been around for a long time. Really, after the EMR, electronic medical record softwares, and have been adopted by the healthcare, both in Canada and US, since about 15 years ago.
Wow, that's a big problem I can see. And traditionally, we know that healthcare technologies, they take away the clinical acumen of doctors. As you mentioned, doctors not looking at the patients when they should. And this has led to erosion of healthcare outcomes. And of course, there are also significant challenges in overcoming privacy issues, including compliance to HIPAA. How does Tali overcome these challenges that traditional healthcare technologies, have posed?
Um, First and foremost is that the team, the co-founding team, has a lot of experience in building solutions for healthcare and medical space. So we are very aware of all the regulations and also privacy and security requirements in this space. And we make sure that everybody in the team is trained to understand the importance of the information we're gathering, and also is trained on making the right decision when it comes to protecting its information. But there is a lot of technical measures in place as well. One is that we try to not to link the log of the conversation between a doctor and a patient to the patient metadata. We anonymize and de-identify the content of the conversation. If there is a mention of the patient name or any identifiers in the conversation, we encrypt the data in transit and at rest. So there's a lot of measures that we have put in place to make sure that the product remains safe, especially in the early days where this solution category is still new, and having the patient audio recorded and processed is a new offering to the healthcare. We want to make sure that we are very cautious and careful about how we deal with this information.
Absolutely. And do you think Tali will integrate itself into existing healthcare technologies, like, especially in the US where Epic has a stronghold? Would you be looking to do such an integration or entering into their ecosystem?
Absolutely, yes. I think we are offering Tali in different modalities for the exact same reason. We don't want to be another piece of technology that physicians have to juggle around. So whenever there is a path for integration with an electronic medical record software, we have jumped on the opportunity and we have integrated, and we continue to do that. But we also realize that a lot of the physicians would love to start getting started on Tali, but on the other hand, some of the EMR companies or older technology companies in place are very slow to integrate with. So for that reason, Tali is offered in multiple modalities, and whenever an integration possible, we're doing that. Whenever integration is slower, we're working through that and offering Tali as an independent solution in the meanwhile.
I see. So what are your plans for Tali in the near future? What are you looking forward to?
So right now, with Tali, you walk into your doctor's office. Your doctor will turn on Tali, will listen to the conversation, and we help prepare the documentation. But as important as it is to support the clinicians at the point of care and at the point of encounter with the patient, we realize that the documentation problem is not limited to that point of care only. There is a lot more that we need to cover. For example, after each patient visit, clinicians would have to fill out lots of forms for prescriptions and lab requisitions and billing. So supporting them with those. So really covering the documentation and administrative problems from the point of scheduling to the point of billing end to end is a path we're going toward, and really supporting the more of the workflows and of not just the physicians, but if there is a nurse practitioners or a physician assistant that's supporting them as well in a more holistic solution.
That's amazing. So, I mean, what would be some words of wisdom you would advise an aspiring healthcare startup founder?
It depends on which area of the healthcare these founders are thinking of entering, because it's a very complicated system that we're talking about. But in dealing with providers, initially when we were starting, everybody was advising against building a solution for doctors for multiple reasons, because doctors are very tired and exhausted with technology. So they are there's a lot of friction if you want to put another piece of technology in front of them. They're very busy, so I was told that it would be very hard to gather feedback and fine-tune the product for a group of users that are very busy to even talk to you or respond to your emails. And any VC you talk to, they prefer the patient-facing technologies much more than they prefer the clinician-facing technologies. But I think my experience was that when the problem is significant enough, that's top of the mind for these clinicians, and the solution is actually effective and it's actually solving their problem, clinicians are some of the most collaborative, smart users that I have worked with over the past 10 years that I have been building for healthcare. They are very generous with their comments. They're very smart with the ideas they share with us. They're very supportive. they have been advocating for Tali in their groups as well, which is very unique and encouraging for us. So I think point of wisdom for me is focus on the real problem and try to offer a solution for that real problem that's effective. And when you hit that point, everything else will, every other barrier, I think, most of the time will come down. Another problem that initially when we were starting was that EMR companies, electronic medical record software companies, will be very hard to integrate with. They will be very close to any new integrations. But again, when the problem is significant, when the doctors are asking for the solutions, then EMR companies become more collaborative as well. So yes, back to that, like when go after the right problem and offer an effective solution, and everything else will come through.
That is an amazing piece of advice. Mahshid, it's been quite a ride, and I'm really looking forward to tracking your continued success on the horizon. And once again, to our loyal listeners, thank you for tuning in. I'm your host, Cheng, the CEO of Supercharge Lab. And once again, on behalf of the AI Partnerships Corp, I'm signing off. Thank you.
Thank you so much.